Good morning, everyone. I want to welcome you to our Rock City Boxing participants and caregiver lecture. We are very, very lucky today. We have Erika Adelman with us. She is a social work resource liaison, Parkinson's and Movement Disorders Program, and program coordinator for APDA Information and Referral Center at the New York Presbyterian Brooklyn Methodist Hospital. You're going to totally enjoy this. She is exceedingly knowledgeable. And after she finishes speaking, we'll unmute everybody. So if anyone has any questions, she'll be more than happy to answer them. So Erika, it's all yours.
All right. Good morning, everyone. I'm just going to share my screen. All right. And you can see it? Okay.
Yes.
All right. So before I would begin, I would like to thank Amy Michon, Linda Eber, Louis Ezrak, and the teams of both the Sephardic Community Center, as well as Evolve Physical Therapy, for putting together this program and inviting me to present today. As most of you already know, Parkinson's disease is defined as a movement disorder because of the visible symptoms such as tremors, rigidity, slowness of movement that typically come along with it. While Parkinson's has traditionally been considered a movement disorder, it's also now recognized as a complex condition with diverse clinical features that include neuropsychiatric and other non-motor manifestations. With that being said, medications, therapies, and surgical interventions are only half of the tools. Okay, maybe a little more than half of the tools that are needed to battle this disease. There's also another large component that needs to be addressed in order to manage Parkinson's, which includes targeting and assessing one's overall well-being, AKA their psychosocial needs in social work terms, because if the psychosocial needs are neglected, they not only can exacerbate an individual's symptoms, but it could have a significant impact on the person with Parkinson's daily functioning, their quality of life, and pose a significant burden onto the caregivers. So this is where someone like me, who's a social worker, comes in handy so that we can assess, address, and intervene. As a social worker, I know firsthand that navigating the social service and healthcare system can be incredibly difficult for just about anyone, because most people don't know what they're looking for. Some people don't know what to ask, or they get names and numbers of a bunch of people that they're told to call, but aren't always provided with all of the specific details that they need. And many just get the runaround. If none of you have been to social services or a Medicaid office, then I can almost guarantee that most of you, if not all of you, have encountered one of the scenarios that I just mentioned. Therefore, my goal before you get off this call today is to go over some of the information and resources that you and your loved ones might be able to apply to your respective situations in an effort to help you maintain your independence if you're a person with Parkinson's on this call, reduce your stress, improve the quality of life of all the parties involved for the person with Parkinson's care, and so that you can avoid one of the aforementioned situations. The good news is that there's a lot of resources that are available to you and your families. Therefore, it's also my job today to show you how to access them. So here's the big question. What does a social worker do? Officially, as a social worker, I'm responsible for assessing and attending to the different psychosocial needs of a patient. And by the way, when I use the word patient in my context, I'm referring to the individuals that I meet with who are living with Parkinson's. So forgive me in advance for using this term interchangeably. Anyways, this means that it's my responsibility as a social worker to ensure that a patient's basic health needs are not only being met, but also their emotional, mental, and social well-being are being addressed as well as their caregivers. And when I say caregivers, I mean anyone that's involved in their healthcare. That could be spouses, family members, friends, or hired caregivers as well. Everyone with Parkinson's is different, not only in how he or she feels or is affected by the disease, but how they react to life changes associated with getting a diagnosis. For this reason, the treatment really should not just focus on the disease itself, but it also should focus on the individual's needs and preferences, as well as the family and caregivers. So when a patient comes into our office, like in the center of the one that I work in, what happens is that I meet with them and their caregivers to discuss any concerns that they have, and we work together to determine on how we can address their needs through various resources, such as the ones on my next slide. This is a list of resources and services that a social worker like myself could help with, but it's not a comprehensive list or a list of everything that a social worker can do or help with. But I highlighted these areas because these are the ones that I frequently get asked questions about. I'm going to go over each of these things briefly, since it's a lot of information to discuss in such little time. Therefore, I'm going to do the best that I can. I kind of ask that if you have any questions to hold them until the end, and I'll be happy to address them then. So, since I began working in this field, I've learned from many individuals that having a diagnosis of Parkinson's can feel like having a label for some. And many people focus on what they can't do or what they used to be able to do instead of focusing on what they still can do, which in turn could lead to depression, anxiety, and social isolation, which, as you know, is not good. So one of the areas that a social worker can help with is finding local programs that individuals can participate in. The programs listed here are only some of the many programs offered in our local community, whether it's in person or over Zoom. There's Sing for Parkinson's and Dance for Parkinson's that's offered by Mark Morris and the Brooklyn Parkinson's Group, where they use singing as a tool to practice relaxation, breathing, posture, and performing exercises to improve the loudness of one's vocal tone. They most recently had implemented a music class also at the Sephardic Center that some of you are at right now, which can help with these things as well. Dance for Parkinson's is used to improve mobility, balance, posture, amongst many other things, and it's fun, of course. At Methodist, we offer a Parkinson's dance class twice a month, excuse me, which is taught by instructors trained by Mark Morris. If singing and dancing don't fit your fancy, there's also Parkinson's boxing, which is offered at Evolve Physical Therapy, Gleason's Gym, and at the Sephardic Center, which helps to improve gait, balance, coordination, and overall positive well-being. Over at LIU, they offer a Fitness for Parkinson's class, which is a group training program that focuses on maintaining and improving strength, balance, and flexibility for people with Parkinson's. The Prospect Park YMCA offers one-on-one training sessions, as well as drop-in aquatic therapy classes, yoga classes, Tai Chi, and Pilates, where individuals can just drop in and participate at a low cost. There's also the Silver Sneakers programs that you could apply for all over the place, which gives qualifying individuals access to various facilities, equipment, pools, and fitness classes at no cost. Older adults who enroll in one of many Medicare health plans that include this program as an insurance benefit are eligible, but you can check on silversneakers.com for more info. And while we are still on exercise, when someone asks me what's the best exercise, I say any. Some of my physicians would respond, the one that you enjoy the most. And listen carefully, I'm gonna give some tough love here. Even if you're someone that is wheelchair bound, guess what? You can still exercise from a chair. Therefore, now you have no excuse. If you're someone who's struggling to motivate, I'd highly recommend that you try a class and or work out with your caregiver. If it means having a contest to see who can keep the other one more motivated and exercise the most at the end of the month, then go for it. Whoever exercises the most gets a prize at the end of the month, whether it be a dinner, a $5 tchotchke or flowers, or just a simple thank you. Also, it's important to know that if you or your loved one are going for physical therapy and occupational therapy aren't enough. We gotta practice those exercises. So I'd recommend having the therapist write down the exercises so that you can practice them on a daily basis, because physical therapy doesn't always last forever. So it's important to acknowledge that, and that you have some control over what you do with what you learn. While you may not have control over receiving a diagnosis, what you do have control over is how much you exercise. and what you put into it is what you'll get out of it. And I'm stressing the importance of exercise because while we can't predict the future, one thing that we do know is that if you do not exercise, you will regress. So with that being said, exercise, exercise, exercise. Aside from the exercise classes that I already mentioned, there are many senior centers in the community that not only offer exercise programs, but they also offer all kinds of activities where you can participate, such as cooking classes, knitting, mahjong, poker, book clubs, and there's opportunities where you can go on trips, socialize, and you can even really enjoy yourself. The good news is that because the COVID numbers are dropping, we're seeing more of these centers open back up, and we hope that they will continue to do so as we enter into the spring. But for those of you who are still ambivalent about getting out of the house, and that's more than okay, there's lots of programs like Mathers or Dora Without Walls that offers telephone programs that you can get involved with. So I'd encourage you to look into that. And for those of you who are living with someone or have a loved one, with some sort of cognitive impairment, there's adult day centers like the New York Memory Center, which is designed to sustain functional independence, reduce agitation, depression, and caregiver burnout, as well as improve disease-related behavioral symptoms. They offer full-day programs that include things like brain training, art, poetry, exercise classes, and support groups. They also offer transportation. Again, these are just some of the types of programs that are offered in our community. But if you aren't from the New York City area or Brooklyn, there are all similar ones all around the cities and in other states. The best way to go about finding them is calling the national hotlines for organizations like the American Parkinson's Disease Association and Parkinson's Foundation to find out where they are. They're also offering lots of virtual programs now because of the pandemic. So I check it out on Zoom and Senior Planet or the national associations. What I'm saying here is that I've just served you a menu of things to do. Therefore, if you or your loved one on this call are someone that spends a majority of your day sitting home on the couch and watching TV, then my hope is that you'll realize that there's plenty of things to do in the community or online other than going to your doctor's appointments, and that you'll work on getting more actively involved in some of them, whether it's online or outside of your house. And if you didn't like what was on my menu that I just served you, there's more on it, but you have to speak with a local social worker to explore your options further. Now, moving on. Senior services. So agencies like the ones listed, such as Met Council, Department of Aging, JASA, Heights and Hills, OHEL, Catholic Charities, JCC, and New York City Department of Veteran Services. I'm sure some of those names ring a bell for some of you. But did you know they offer several senior services to the community? Let's look at that a little closer. The agencies that I just mentioned are only some of the senior service agencies that exist that can provide in-home, virtual, and/or community-based services for older or disabled adults in our area. Many of the things that I will touch upon will be listed on the screen, but they sometimes offer even more than what's listed. One of the biggest benefits of these programs is that they can connect you to resources that you need and help facilitate the process, while providing support for both people with Parkinson's and their caregivers, which is great, especially if you don't have a social worker within your neurologist or movement disorder specialist office. Transportation, this is a big one. Transportation is a big concern for many individuals because they need it not just to get to appointments, but to get to places like grocery store, the pharmacy, or anywhere else that they need to go on a daily basis. If you can drive, but have some difficulties with things like gait, balance, and ambulation, you may be able to get a parking permit or license plate so that you can get handicap parking. But this is only if it's medically necessary. Otherwise, there will really be no parking in Brooklyn and around New York City. And by the way, while we're talking about driving, because I know that there are some people with Parkinson's on this call, it's important for you to know that if you or your loved one are someone that's taking Parkinson's related medications and are hearing your caregivers say, honey, maybe you shouldn't be driving, then listen to me carefully. Maybe you shouldn't be, but maybe you should. And the way to do this out is that your caregivers aren't really necessarily trying to take away from your autonomy or control you by taking away your keys. They just want you to be safe. On many occasions, this causes the battle to begin. In my groups, we like to call it the battle of the keys. Sound familiar? I'm sure. So what I am going to tell you right now is hopefully this will help end the battle of the keys. So if you are taking Parkinson's related medications, I strongly urge you to go get a driving evaluation and to make sure that you're truly safe. Because forget about your caregiver for a moment, and no disrespect to all of you, but did you know that if you are taking these medications and get into an accident, then you can get charged with driving while in ability impaired, which is basically as serious as getting a DUI, because you're going to put your life at risk as well as others. So not only will you have to deal with your caregiver then, but you might also have to deal with cops, judges, lawyers, fine, possible jail time, answering to other families, and the fact that you could have or did hurt yourself or possibly somebody else. So the take-home message here is to go and get a driving evaluation sooner than later. Triborough Driving Rehab in Brooklyn is just one example of a place where you can go to get an evaluation. So then you can say that you could still drive, and at least you got it done, and you won't have to continue having that same conversation between you and your caregiver anymore, which will technically be a win-win for all parties involved. And for the caregivers on this call, you're welcome. But what do you do if you need to get somewhere and you are someone who doesn't drive and you have no one to take you? You can apply for a reduced fare Metro card, take a bus, train, taxi, or if you're tech savvy, you can get an Uber or Lyft. But these options could be a little pricey. Therefore, if you live in New York City, or Brooklyn rather, you can also apply for Access-a-Ride, which provides shared door-to-door transportation for eligible riders whose disability prevents them from using accessible mass transit, bus, or subway for some or all trips. Logistic Care provides shared door-to-door transportation for eligible riders who have New York City Medicaid and managed care enrollees, except MLTC plans, who are receiving Medicaid coverage services from a medical practitioner. Therefore, that practitioner may request transportation from a Logistic Care for those who ride it. If you have an MLTC plan, try contacting them to see if they offer transportation for you. Also, I learned that the JCC of the Greater Coney Island has a transportation program for those who do not have Medicaid, and their program will not only transport you, but they'll transport your caregivers as well if you are deemed eligible. Another area that social workers help with is applying for prescription assistance programs. There are several ways to go about this, depending on the type of medications that you're prescribed, the insurances that you have, your income, and other various factors that we'd like to take into consideration. But social workers can help you navigate that process. One option that you may have is to apply for assistance through the pharmaceutical companies. Most drug manufacturers do offer copay assistance programs. Many of them also have savings cards, or sometimes they can set you up for some free prescriptions depending on your situation and what's being offered. You can get discount cards from companies like GoodRx and NYRx card. There's online programs like Needy Meds or Partnership for Prescriptions that can help you find a program that are right for you. Otherwise, you can compare local pharmacy prices when you get prescriptions to save money, or enroll in a mail order program to reduce the cost. New York State also offers the EPIC program, which helps seniors 65 and over to supplement their out-of-pocket Medicare Part D plan costs. Seniors may apply for EPIC, or those on Medicare rather, but must be enrolled into the Part D plan. EPIC is often used in conjunction with the Medicare Part D or other prescription plans to lower drug costs and assist those who need medications with paying deductibles and co-payments required by the drug plans. There's no guarantee that the meds that you take will be covered on these programs, but there are lots of options to explore. There are also sometimes grants, like those provided by the Assistance Fund, that may cover the cost of your meds, but each individual situation is evaluated on a case-by-case basis. If your medications are still too high After you exhausted all of these options, then you may need to speak with your physician to see if you can get prescribed something else. Okay, home care and respite. So by a show of hands, how many of you have used home care or know of someone who has? Okay, yeah, quite a few. So you can see why I get a lot of questions about both. And I find that people are often confused about the difference between the two. Home care services typically involve home health aid services that can include skilled nursing, occupational therapy, physical therapy, speech therapy, social work, and home safety evaluations, if the patient is homebound and has a skilled need. In-home respite provides family and caregivers with a break from one's home. It's typically offered by a friend, family member, or respite workers. Respite can be provided in the home or in a care setting, just like an adult daycare or assisted living facility. This is a good way for a caregiver to get some time to themselves and for their loved ones to get companionship, as well as assistance with their activities of daily living, like bathing, dressing, and meal preparation. Insurance, more often than not, covers home care, but if you only have Medicare Part B coverage, then your services will be capped, meaning you will only get home care services or rehab services for a few hours for a few days a week, and then they say, I'm sorry, you either have to wait or pay out of pocket. Oh, and by the way, while we're on that, if you and your loved one has Parkinson's, you really should not be paying for home care. For those of you who are only enrolled in Medicare Part B or are currently privately paying for your home care, you may want to look into educating yourself about the Medicaid process and applying for it, especially before April 1st, 2022, because the rules are about to change. I often hear patients say, I'm not eligible for Medicaid. I make too much money. I have a pension and I'll never qualify. So I'm here to tell you that there are legal ways to set aside money so that you can become income eligible for Medicaid, such as putting the money in a pooled trust or a spend down. Therefore, if you're currently receiving home care, many of the providers that you're receiving services from can educate you about the process and help you apply. Or you could speak with a Medicaid specialist, geriatric care manager, or elder care attorney to find out what your options are. In the interim, if you need more hours, you can ask your physician to write a letter of medical necessity request for more hours. But as I just mentioned, insurance companies can set up barriers, so it's important for you to know why you might be hitting a roadblock. And having an insurance plan with limited coverage is one of them. One way to supplement those additional hours where you and your loved one may need the additional care, just like I mentioned before, is through the respite services. So what services are provided by respite? I kind of went over that already, but respite services are much more comprehensive in what they provide. Insurance companies typically don't cover respite care unless you have something like a long-term care insurance policy. Otherwise, you may have to pay out of pocket. The average cost for respite care can range from $20 to $30 an hour, give or take a few. But sometimes paying that price once a week so that someone can watch your loved one so you can get out of the house as a caregiver to do something that you enjoy may just be worth it. There are some programs like Sunnyside Community Services or PSS Circle of Care that might be able to provide respite for free through a grant from the Department of Aging if they deem you or your loved one eligible. There are also facilities that provide short-term or overnight respite stays, but each of those facilities have their own set of requirements. Thus, if respite is not a viable option for you, then you may want to look into adult day centers as they continue to open up. This is also another way to supplement some home care hours if you aren't getting enough and or maybe the cost-effective option. And an individual can receive meals, activities that are offered all day, and you can get a peace of mind knowing your loved one is safe place instead of at home. One sec. Rehab services. So I spoke about a little about this before in the last slide, but you may receive occupational therapy, physical therapy, and speech therapy services in home or in an outpatient setting, depending on your level of functioning. Home care agencies can provide these services if there's a skill need and if someone is homebound. If you need in-home OT, PT, and speech, but don't have an aide or nurse, an agency like Fox Rehab can provide these types of services based upon medical necessity and your insurance coverage. But we highly recommend that if you are able to get out of the house, that you go to an outpatient rehab facility that offers the LSVT Big and LSVT Loud programs. LSVT is also known as the Lee Silverman Voice Training, which is an innovative way to increase communication and movement for an individual living with Parkinson's. LSVT Loud is one of the most practiced treatments for speech because it focuses on vocal loudness and has an intensive 16-session treatment program over a month's time. LSVT Big, which is our physical therapy for LSVT, can be provided by an occupational therapist or physical therapist. And the treatment includes incorporating big movements to increase amplitude of limb, body movements, and improve speed, gait, balance, and quality of life. Like the LSVT Loud program, treatment typically involves 16 sessions over a month time and was developed specifically to address movement impairments. You can go to lsvtglobal.com to find an LSVT trained clinician in your area because they have experience working with Parkinson's as well as the equipment to do so. There are several providers also in the local area, like our friends from Evolve Physical Therapy who are here with us today. And we also have clinicians who are certified at our center, but they aren't the only ones. Now, aside from receiving occupational therapy, physical therapy, and speech, there are adaptive devices and assistive technologies that one may use to maintain his or her independence, such as weighted utensils, shown here like liftware, which is good for someone who has tremors, a commode, which could be placed next to the bed if someone has difficulties ambulating and is going to the bathroom a lot and is up all night or is weak and unsteady. Then there's an ergo pen, which is also good for someone who has tremors or difficulties with their handwriting. And there's something like the automatic pill dispenser. So if someone needs reminders and has difficulties opening pill bottles, this is a great option. There are so many types of these devices out there that, in my opinion, are underutilized. So if you need technologies to help you eat, bathe, write, paint, play guitar, or even take a photo, these are some sites for you. But if you're someone who has trouble with any of these things, you can contact your occupational therapist or a social worker like myself to see if there are any adaptive devices or assistive technologies out there that could possibly help you as well as your loved ones. And it can help you increase your independence. The next slide is about hospice and palliative care. Hospice care is patient-centered specialized program of care and support services for someone who is facing a life-limiting illness. It utilizes an interdisciplinary team that includes medical care, pain management, emotional and spiritual support tailored to a patient's needs and wishes. Hospice focuses on comfort, not curing, with the fundamental principle that each of us have the right to pass pain-free and with dignity, and that our families will receive the necessary support to allow us to do so. Hospice treats the full range of needs with special considerations and attention given to a patient's physical, emotional, and spiritual well-being. It's provided by a team of professionals and volunteers who are experts in the field of end-of-life care at home or in a facility. Medicare has established 3 eligibility criteria for entering hospice, and most other insurers use these as well. 1, the patient must have a life-limiting illness or chronic illness, and the physician must determine that the patient, to the best of his or her knowledge, has 6 months or less to live. 2, the patient or the healthcare power of attorney must accept hospice rather than curative care. And 3, that these services must be provided by a Medicare-approved hospice program. Veterans are covered under the VHA standard Medicare medical benefits package. But here's something you didn't know. Hospice services are not actually just limited to 6 months. At designated intervals, a doctor can certify that eligibility criteria continues to be met. So the person in the final phase of life can receive care as long as necessary. And this is helpful for you to know if you're someone with Parkinson's, because you can receive hospice services wherever you reside, whether it's in the home, assisted living, skilled nursing facility, or even the hospital, but this will require two payer sources. For example, if you're someone that has Medicare and state-funded Medicaid or private insurance, one source will pay for the hospice and the second will pay for the room and board of the hospital or the facility. Or you will have to pay for the out-of-pocket costs. The hospice care team consists of many of the same professionals included in the palliative care team, which I'm going to go into, but they may also include integrative therapists like massage, art, and music, and volunteers. Because Parkinson's is chronic and progressive with individualized course, it can be difficult to determine when the end of life is near. With that being said, hospice may also be used appropriately if the person with Parkinson's has symptoms such as advanced dementia, recurrent pneumonia, weight loss, urinary incontinence, infections, pain, and have experienced reoccurring hospital admissions. If you request hospice, you may contact the hospice provider of your choice, and the hospice team will work with treating the physician to obtain the necessary referral. Palliative care, okay, is specialized medical care for people with the serious illness. This type of care is focused on providing relief from the symptoms and stress from the serious illness. The goal is to improve quality of life for both the patient and the family, and palliative care is provided by a specialty team of doctors, nurses, and other specialists who work together with the patients and other doctors to provide an extra layer of support. It's appropriate for at any age and at any stage in a serious illness, and it can be provided along with curative treatment. Palliative care teams specialize in treating people suffering from the symptoms and stress of serious illnesses like Parkinson's. This type of care also helps to treat pain, depression, shortness of breath, fatigue, constipation, nausea, loss of appetite, difficulties with sleeping, anxiety, and other symptoms that may be causing distress. The palliative care team will spend time speaking with the patient to make sure that he or she understands all the treatment options and choices, and they will also make sure that the doctors are coordinated and know and understand what the patient wants. This gives the patient more control over his or her care. Palliative care teams are specialists who work together with the patients, the caregivers, and other doctors. They provide that extra layer of support treating a patient's symptoms and spends as much time as necessary communicating with all the loved ones involved in the patient's care. This may be a good option for those of you who have had extremely challenging situations. Okay, so the next part of this is the long-term care options and housing. This is a topic that many people sometimes you're away from talking about because some people don't know what it is, and some people just don't want to talk about the future when it comes to this topic. But it's really important because you need to know your options sooner rather than later so that you and your loved ones can plan accordingly. Not everyone will move into one of these facilities, and our goal as providers is to do the best that we can to try to keep you at home. But some people, for some of these people, one of these may be a viable option for the individual and or family in the future for various reasons, but each to their own. Anyways, the good news is that for every level of need, there are facilities that are available. So let's just review them briefly. Independent living facilities. These are for people who can still do everything by themselves, more or less, but want a community to interact with others and have activities and services that are easily accessible to them in the community. They usually have staff on site, but provide minimal supervision. So if you find that this isn't enough, then you can go to an assisted living facility. Assisted living facilities, these are for people who have more challenging time taking care of themselves, or they don't feel safe at being at home anymore. Assisted living facilities also have 24-hour staff that can provide assistance with meals, medications, and basic activities of daily living. Then there's memory care, which is a special type of assisted living. And some of the assisted livings have a memory care floor. But for individuals who are having a cognitive impairments like Alzheimer's or dementia, these facilities have very specific programming that meet the behavioral and cognitive changes needed for the challenges that one with cognitive changes sometimes face. Therefore, at these facilities, they can attend to the individuals who have these types of needs. Then there's skilled nursing facilities, which is probably the one that most of you are most familiar with, because these are for people who require 24/7 supervision, essentially, and need constant monitoring or a higher level of need with their activities of daily living. This is the type of facility that one can go to and insurance usually pays for up to a certain amount. You also know that if you're in the hospital, you will or can transition from a hospital to one of these communities. These communities are good because they typically offer a spectrum of services all in one location. They may offer independent living as well, all the way to skilled nursing. So for people who maybe like to stay in the same place as their needs increase, they have the benefits of not having to move around and change a lot, yet still get the care that they need. So when patients ask about long-term care, social workers usually help them find facilities that they can go to, and we'll discuss these options with them so they can figure out how they are going to pay for all these facilities. Again, this is why it's so important to get educated about the Medicaid process, but sooner than later, because some of these types of facilities have look-back periods. Therefore, it's better to be proactive instead of reactive so that you aren't limiting your options later on. Future planning. I don't want to get too much in depth about this because everyone's situation is different on this call, but I want to let you know that if you have Parkinson's, you may apply for Social Security disability as long as you're not working, even before the age of 65 need be. After that happens, you then can apply for Medicaid. But we kind of went over this, so let's just talk about advanced directives, which is another topic that people don't like discussing. I know many people don't like it, but I encourage all of you who are over the age of 18 to make plans in regards to making these directives sooner than later, because God forbid you end up in a situation where you can't think or speak for yourself, or something happens to your caregiver. You or they can lose your autonomy, whereas now you have a choice. With that being said, there should be a plan in place for individuals and their caregivers in case of emergencies, because every person on this call has a different situation and it's a very complex system to navigate, especially if something unexpected occurs. Therefore, save yourself the stress, and you can get the ball rolling with this by educating yourself or speaking with your social worker to learn more about what all of this entails and what kind of information is needed. And then the social worker can assist you with getting what you need from providers to get your applications completed. And since we're on that topic of advanced directives, towards the end of the slide, you will see there where it says organ donations or donor registry. This is something that's not always talked about enough and is really, really important, because if we as a Parkinson's community truly want to find a cure to this disease one day, then researchers need your help. Whether it's by participating in clinical trials now or checking that box when you're filling out those forms to donate your brain for later. You can help all of us get one step closer to what we're all waiting for. And who knows, while this may seem a little bit eerie and far-fetched right now, it may very well just be your brain that will be used later to find the cure for Parkinson's. So how's that for a legacy? Something to think about. And while I'm mentioning the brain, let's shift over to mental health. So this is a topic that I'm personally passionate about because that's what my background is in. And when I hear people talk about counseling, some people think it's just for crazy people. And I'm here to tell you that it's not. There's a lot of stigma around mental health, and we're trying to break that mold. Just about anyone, if not everyone at some point, can benefit from counseling. And the beautiful thing is that you can speak to someone who is not biased, that could teach you different coping techniques and help you manage different situations, where in turn, the outcome could truly benefit your health, improve symptoms, and help you achieve an overall greater sense of well-being. And it's important to gain a positive outlook on life beyond a diagnosis, because you or your loved ones are more than someone who has a diagnosis or a caregiver with someone who's living with one. With all that being said, I think that many people ignore the mental health aspect of Parkinson's, and it's so important to address it, because when your mind gives up, so does your body. And I've seen so many individuals go downhill because they are so focused on what was, or they get so scared about what will be, and they can't live in the here and now. And while many people, when they get diagnosed, question, why me? I want to remind you that Parkinson's isn't a death sentence, okay? People do not die from Parkinson's. They die from complications of it, like aspirations or fall. And so while, yes, you may be presented with barriers along the way, life isn't over with this diagnosis, okay? The key to battling Parkinson's is to move away from the type of anxiety-driven and or negative mindset. Because what I learned is that those who embrace the positive psychology have better outcomes. Sure, maybe you and your loved ones can't do all the things that they did before, but maybe you may be able to help do those things in a different way, or you can do them in a different way with the help of assistive technology. And that's why bottling up can be so self-defeating, and not going for therapy can really hurt you if you are holding all those emotions. And while depression, apathy, and anxiety surely can be non-motor symptoms for some, or existed way before an individual got diagnosed, the key is to get those symptoms under control. Because what we do see is that when they aren't, motor symptoms can get exacerbated. And for caregivers, it's just as important for you to go get therapy as well, because when that anger and frustration or that tiredness builds up, that can also have a snowball effect. And I have met and had many individuals in my program who have had Parkinson's for 20, 30, 35 years and plus and still are going. You want to know how? It's important for you and your loved one just to go find a purpose and work on creating a new normal. Once you and your loved one are able to find that purpose, whatever it be, your kids, your grandkids, your dog, your friends, whatever it may be, channel into it, because none of us know our fate, okay? And this is something that could possibly add more time to your clock when you have purpose and work on creating that new normal. So channel into it. And if you're someone that's really struggling to find your purpose and you're really, really down, then that's one more cue that maybe you would benefit from therapy. So how do you even get therapy? You can ask your movement disorder specialist or primary care for a referral, contact a local service, social service agency, insurance company, contact your social worker, or you can use the internet. But you can check out psychologytoday.com or zencare.co to find a provider who will suit your needs. And this will help you find a psychologist, social worker, or a psychiatrist. There's no Parkinson specific psychotherapist as of yet, but you could look for therapists that deal with chronic illnesses, depression, anxiety, adjustment disorder, coping skills, or whatever other mental health need that you have or you currently might be dealing with. Also, when I say the word therapist, I don't mean a psychiatrist, because they only see you for maybe once a month for about 15, 20 minutes and prescribe you medication. That's not therapy. A therapist is someone who might be a licensed social worker, psychologist, or mental health counselor. And these types of providers can provide you with weekly, biweekly, or on an as-needed basis counseling for 45-minute sessions, depending on what your need is and how the rules of the practice are. Insurances typically will pay for mental health services, but if that's going to cause a dent in your pocket, you might be able to find a therapist who will work with you to pay for treatment on a sliding scale basis, which is almost like a reduced payment plan. Thus, you will have to check in with your insurance plan to see if you need a referral for this type of service. And another way that you can attend to your mental health needs is by joining a support group, which brings me to my next slide. Support groups. Support groups are something that I truly encourage all of you to participate in, no matter what stage of the disease that you're at, or whether you're a caregiver, because support groups will give you an opportunity to discuss your concerns and learn from others that are living with the disease, as well as professionals that are experts in the field. And who better to learn from than them? And yes, no two people with Parkinson's are ever the same, and everyone's situation is pretty different. What I can say is that most individuals at one point or another in the support groups have same questions or need the same information. And by joining a support group, you can gain additional layer of support who are committed to confidentiality out of respect to the other members of the group. You can have the opportunity to socialize, get out of the house or get onto Zoom and be a part of a community so that you're not isolated. And maybe if you get to go in person, maybe there'll be some food Or most importantly, you'll get information about some of the topics that maybe you and your doctor didn't get to cover during your visit. Also, in terms of support groups and there are all different types of support groups. There's open discussion groups, sometimes there's educational support groups, and sometimes there's a combination of them both. So as someone who facilitates both patient and caregiver support groups on a monthly basis, I highly encourage you to try these groups more than once, because in my experience, there are always different dynamics, and it takes time to build a rapport with others, especially if you're doing it online. And I'll say it again, no two people with Parkinson's are ever the same. So if you come to the groups and you see somebody who has symptoms that you don't have, or maybe that is more progressed than you are, it does not mean you will ever acquire the same symptoms, nor will you ever advance the same way. So don't compare yourself or get scared, because these groups always have a wide range of people that attend them. And don't let that deter you. And if you aren't ready for that just yet, there are telephone support groups and plenty of virtual Parkinson's specific groups like DBS, Young Onset, General Support Groups, Caregiver Groups, and Veteran Support Groups, as well as online support group threads such as Smart Patients Community, which you can find on the APDA website under Education and Support. And on this online thread, you can speak to individuals all over the country anonymously, 24 hours a day, 7 days a week. But you heard what I said before about no two people being the same. So what may work for someone else may not work for you. And if you get a tip regarding some sort of pharmacological approach, please always consult with your physician. And caregivers, all these types of groups are open to you. So I encourage you to participate in them too, because it's important to get the support you need in order to help your loved ones, even more so now that I brought that up. Let's talk about caregivers. Listen up. So to my caregivers on this call, it's super important that our caregivers take care of themselves, because if you don't take care of yourselves, then how will you be able to take care of your loved one? With that being said, it's important that every caregiver on this call schedule time for themselves, preferably on a daily basis, even if it's 20 minutes a day at the bare minimum, where you can practice some sort of form of self-care, or do something that you love, because everyone needs time to themselves to recharge. It's so easy to get wrapped up with caring for your loved one that you forget about you. And if you're someone who isn't making any time for yourself, well, then guess what? That's how you burn out. Caregiver burnout is very real. And so if you're someone who's a caregiver that isn't getting sleep, are feeling tired, are overwhelmed all the time, and can't get things done that you need to do for yourself, or you find yourself crying a little bit more, then that's your cue that you aren't implementing enough self-care into your daily routine. And if it's because your loved one won't allow you to have that self-care time because they feel they need you every second of the day, then it's time to reach out to your social worker or care team so that we can get you the resources that you need, like the ones listed on this slide for education and support, maybe some respite and coping tips. And please don't be afraid to ask, because as professionals, we are here for you. And understand that when someone is diagnosed with Parkinson's, that it affects not only the individual that has it, but it also impacts every member of the family. And this is very normal, okay? So we can't help unless you ask. And by the way, while I'm bringing this up, for those of you who aren't a caregiver, it is also a job to make sure that your caregivers are getting that time to themselves. And if it's because they're not getting it because you need assistance, and realize sometimes we may recommend that aids or respite may not just be for you. It may also be there just to help your caregivers and give them a break. So please give them the time and don't make them feel guilty about it, because they're doing the best that they can to help you. Therefore, all I'm asking is for you to do what you can to help them as well, so that they can best help you. Education and resources. Well, you'll see this on this slide, and some of the various national Parkinson's organizations that exist can provide you with up-to-date, credible information, education, downloadable publication, webinar support, research, and resources. Obviously, these aren't the only credible sites that exist, But I can't tell you how many people I meet that come into our office or call me and say, hey, you know what I read on the internet? On the internet, it says, just stop right there, okay? If you're one of those people, then I'm going to kindly advise you to break up with your relationship with Dr. Google right now, because there's a lot of information out there, but there's a lot of bad information that's not credible. So we don't want you to read information that's not, because that could scare you. And we want you to get educated. So don't confuse this. But if you are going to do so, we recommend sticking to the sites like the ones that are listed on this slide. And if you want some additional information, then speak with your social worker or call the hotlines for American Parkinson's Disease Association or Parkinson's Foundation, or some of the other various national organizations here, so that you can get that info. Also on this slide, you will see resources for veterans, which, by the way, the American Parkinson's Disease Association has a wonderful handbook specifically designed for the veterans community. And there's also websites listed here that discuss clinical trials on the slide that are being done, and you or your loved one may want to check those out because you may be able to participate in some of them. Furthermore, on the slide, there are community resources like HeightSite, the National Benefits Checkup website, where you can look into federal benefits that you and your loved one might be eligible for, and the Movement Disorders Specialist Finder, which is a website where you can go if you or your loved one are currently not seeing a movement disorder specialist, which is typically recommended when you or somebody you know is diagnosed with Parkinson's, because they had more advanced training with Parkinson's and other movement disorders. So we'd recommend you see one if you have never done so. So accessing. So while I could sit here all day to talk about resources, because I have many of them and I love this topic, there are so many of them that are offered through the state and on a federal level, and we don't have that much more time. So now now that I reviewed some of what's out there, let's talk about how you can access some of these resources. In order to obtain these services, benefits, entitlements, one can speak with your movement disorder specialist to generate the referrals, or they might be able to write a letter of medical necessity if you really need so. You can also meet with the social worker in the center if your movement disorder center has one, or you can meet with a social worker in the community to get the ball rolling. And if you don't go to a movement disorder center like ours, and your physician's office is not set up like the way our center is, you can still get help accessing these resources by speaking to the primary care physician or general neurologist, contacting a local geriatric care manager, asking coordinators from the home care agencies. You can reach out to Medicare offices, Department of Aging, or 311 if you're in New York City, or you can call the national hotlines like American Parkinson's Disease Association or Parkinson's Foundation to get information and referrals from them. Okay, so there's lots of ways you can go about getting them. So in summation, there are many benefits of having a social worker on your care team or utilizing social services and resources that are offered in the community. It can have psychological benefits, such as social contact, prevent social isolation, prevent relationship breakdown, or improve psychological well-being and quality of life. Physical benefits, such as mobility, independent living, improve safety, or prevent deterioration of condition or general health. It can have service or societal benefits, such as avoided living in residential care, avoiding hospital admissions or readmissions, and saving money. And it could have care benefits, which is psychological well-being of care, prevent care from becoming ill, or prevent relationship breakdown. So with that being said, I'd like to thank you all for your attention, and that I hope that after hearing my presentation, that you realize that there's lots out there that can help you and your loved ones. No one has to go through this journey alone, especially those of you who have no other family or additional supports. As a Parkinson's community, we are all in this together. So therefore, don't be afraid to reach out and ask for help. Thank you. So I'm gonna stop my screen. and open this up for questions. All right, Amy, you're on mute, so do we have questions? Anybody? Any questions? You can either take yourself mute, or you can raise your hand and we can call on you.
You want to unmute yourself?
Unmute everybody. Okay, everyone, you can unmute yourself if you have any questions for Erika.
No,
That was very, very
Thank you
clear.
so much. We greatly appreciate this. It's always a pleasure when you do this. Is there any, yes,
Yeah,
I
I have
have
a
someone that
question.
has a question for you.
Yeah, hi, Erica.
Hi.
Erica, could you give me that information about the driving evaluation, the rehab, you mentioned driving rehab?
Triborough Driving Rehab. They're located on Coney Island Avenue, but
Assez là avec Balia, même si ça va pas.
And they give it,
Bon, bah, quand on veut dans la toile,
hold on. Wait, what were you saying?
I remember, the rest of the question was, do they certify then that the person can or cannot
They can-
drive?
Yes, so they will do the evaluation, certify whether he or she can drive. And if there's any limitations, they'll mark that as well. And they also can help modify vehicles if somebody has different limitations.
Right,
that-
okay.
Take paper.
So do we need a doctor's note to take this test or not? No, just pull up and, okay.
Yes, ma'am.
Thank you.
Thank you.
Thank you.
Anybody else? Any questions? Any questions? No, there's a lot of information to digest, so. Okay.
you gave us enough information. Now what we have to do is to take time to review what you gave us and see what we need to do.
That sounds like a
Thank you.
plan, Edith. So
Thank
if any of you need to reach out to me after this presentation to find resources that will be fitting to you, you can always either call me at 646-704-1792. That's 646-704-1792. And I'd be happy to assist you or your loved ones. And if you cannot write, that's okay. You can contact the Sephardic Center and they would be happy to provide you with my information. But I'm here for you and I'm here for your loved ones, and we're all in this together. So, thank you. Amy, I think we're gonna close up.
Again.
She didn't hear you.
Step back. Thank you again, and thank you all for coming, and we look forward to seeing you all again when we do this. Have a great day.
Thank you. Well, enjoy your lunch, everyone.
Thank you, Erica.
Thank you.